Welcome to today's video on physical activity and pregnancy. In this video, we'll be looking at the benefits and contraindications of physical activity during pregnancy and the postpartum period, as well as the consequent role for healthcare professionals. Well, to start off, there is no evidence of harm. The UK Department for Health offers guidance containing 3 key messages regarding physical activity in pregnancy. The first of which is that there is no evidence of harm from moderate intensity physical activity, which is supported by multiple systematic reviews and meta-analyses. Regarding maternal health, several national bodies support moderate physical activity to reduce the risk of developing hypertensive disorders and gestational diabetes, as well as an improved cardiovascular fitness and a lower gestational weight gain. One systematic review and meta-analysis, which included 74 trials and over 17,000 mothers, found this decreased weight gain by an average of 0.7 kilograms, thus making it easier for mothers to return to a healthy BMI postpartum. It's worth noting, however, that in this review, not all reductions in morbidity were statistically significant. Regarding the offspring's health, again, there is no evidence to support harm. Academics have also postulated that there may be a decrease in the prevalence of chronic disease later in life. The fetal origins hypothesis states that events during fetal development impact on the risk for developing future adult disease. This theory gained traction following study of the Dutch population who were born shortly after the Hunger Winter of 1944. Nazi occupation of the Western Netherlands meant that the population was subject to as little as 400 to 800 calories a day, and later had far higher rates of metabolic and cardiovascular diseases. Therefore, physical inactivity could also detriment a fetus's future health. Contraindications arise from both maternal factors and activity factors. Here are 2 lists of absolute and relative contraindications based on maternal factors. In short, if a mother has severe disease or an uncontrolled disease of pregnancy, then they should speak with an obstetrician before commencing any activity. Furthermore, if a mother starts to feel any unusual symptoms during activity, such as vaginal bleeding, painful contractions, and dizziness, then the activity should be stopped. This relates to the key second safety message from the Department of Health: listen to your body and adapt. The final key message is don't bump the bump, meaning that activities with a risk of abdominal trauma, such as contact sports, horse riding, or tennis, are contraindicated. Scuba diving, due to physiological pressures, and supine or lying activities, due to compression of a gravid uterus on the inferior vena cava, thus restricting cardiac output, are also contraindicated. Furthermore, women who are not already active should avoid strenuous activities, including running and strength training. The Department for Health recommends 150 minutes of moderate intensity activity and 2 muscle strengthening activities every week. In the UK, activity levels fall dramatically when a woman becomes pregnant. Consequently, healthcare professionals have a duty to combat this deleterious health trend. Healthcare professionals should also inform mothers to keep cool, comfortable, and hydrated during activity, to start activities gradually if they are currently inactive, to stick to moderate activities where an individual can still talk comfortably, and to give the 3 key health messages: no evidence of harm, listen to your body and adapt, and don't bump the bump. Due to hormonally induced ligament laxity, there is an increased risk of injury from activity in postpartum mothers, particularly if they are breastfeeding. Consequently, high-impact activities should only be commenced 6 weeks postpartum and when medically safe to. However, pelvic floor exercises are recommended from day 1, and mothers are encouraged to gradually work physical activity into their tasks of daily living. Furthermore, nursing mothers should always ensure adequate hydration and consider activity post-feed to avoid discomfort. Thank you for watching. For further information, please see the links presented shortly. And remember, exercise is so important, not just in pregnancy, but the prevention of a plethora of diseases, and is mentioned in over 76 NICE guidelines.